Hi, I'm Amber Holt, and I'm going to be discussing the public health threat of the coronavirus. The coronavirus disease, also known as COVID-19, is an infectious disease that is thought to spread mainly from person to person. It mainly spreads through drops of saliva or nose discharge from an infected person that coughs or sneezes. These drops can end up in the mouths or noses of people who are close by, or possibly be inhaled into their lungs. The disease may also spread between people who are in a close vicinity with one another. In fact, recent studies have indicated that COVID-19 may be spread by people who do not appear to show symptoms. According to the Center for Disease Control and Prevention, which is updated daily, most people infected with the COVID-19 virus will experience a degree of respiratory illness and recover without needing treatment. Older individuals and those who have underlying medical conditions such as cardiovascular disease, diabetes, and autoimmune disease, chronic respiratory disease, and cancer are more likely to develop serious illness. Individuals with COVID-19 have had a variety of symptoms reported, which range from mild symptoms to severe illness. Symptoms may not show until 2 to 14 days after exposure to the virus. Those symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. These are not all the possible symptoms, however, the CDC continues to update this list as they learn more about the virus. The best way to prevent and slow down transmission is to be well informed about COVID-19, the disease it causes, and how it spreads. You can protect yourself and others from infection by washing your hands or using a hand sanitizer frequently, along with not touching your face. You should wash your hands often with soap with water for 20 seconds or more, especially after you've been in a public place or after coughing or sneezing. It is important to avoid touching your eyes, nose, and mouth in general, but more so with unwashed hands. If you're outside your home, you should put 6 feet of distance between yourself and those who don't live in your household. Keeping distance from others is particularly important for individuals who are at a higher risk of illness. You may spread COVID-19 to others even if you do not feel sick. A cloth face cover should be utilized to protect other people just in case you are infected. Everyone should wear a cloth face cover in public settings, especially when other social distancing measures are unable to be maintained. However, cloth face coverings should not be used by children under age 2, individuals who have trouble breathing, or someone who is unconscious or incapacitated. It is important not to use a face mask that is meant for healthcare workers. As of now, surgical masks and N95 respirators are critical supplies that should only be used by healthcare workers and first responders. Nevertheless, everyone should continue to keep a 6-foot distance between themselves and others because the cloth face cover is not a substitute for social distancing. At this time, there are no specific vaccines or treatments for COVID-19. However, there are current ongoing clinical trials evaluating potential treatments. The World Health Organization continues to provide new and updated information as soon as clinical findings become available. All we can do right now is be alert for symptoms, which is especially important if you run essential errands, go into a workplace, or in settings where it may be difficult to put a physical distance of 6 feet. Take your temperature if symptoms develop, but not within 30 minutes of exercising or after taking medications that could lower your temperature. If symptoms do develop further, follow CDC guidance and get tested as soon as possible. Thank you.